You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Westchester County's go-to implant dentist. We have Dr. George Sepiashvili. Dr. Sepiashvili, welcome to the program.
Thank you for having me, Randy. Good to be back.
Now, your patients call you Dr. George.
They do.
Is that right? Much easier to
Much
do?
easier, yeah, and friendlier.
And I said Westchester, but you draw from a big area, right? People travel to see you.
We have people coming from all over. We have patients traveling from other counties in New York. We have people traveling as far as Florida and California.
Okay, good. And now for people that don't know your practice, I guess you also work with your wife.
Yes.
She's been on the show as well. But for people that don't know your practice, who's the typical dental implant patient that you see?
I would break them up in two categories, Randy. One are denture wearers. They've had dentures made for them. They are unhappy with the way they smile, with the way they are unable to eat and chew. They're just not comfortable. They're looking for better options.
Okay.
Some of them have been told they have no other options. That would be one category.
Now, by the way, for those people, you've told me, on the day of the procedure, like a denture wearer can walk in with no teeth and walk out with upper and lower teeth. That in some cases don't come out.
That's exactly right.
Is that rare? Or
No, that's every day in our office.
Okay.
You walk in, no teeth. You walk in with ill-fitting teeth or teeth you're not happy with, that you've been dreading wearing for this whole time, years, sometimes decades. You walk out with teeth you can be proud of and teeth that are staying in. They're bolted in your mouth. They don't come out.
Very nice. Now, the second category of patients are what?
Second category of patients are patients with failing teeth, with terminally ill teeth. Those are your typical bleeding gums, hurting teeth, bone loss. This process for a lot of these patients, it's a long and painful process. You lose one tooth here, another tooth there, and one day you wake up, you have no teeth to chew on, you have no teeth to smile with. Well, this process is completely opposite to that.
Okay.
Doesn't take you years to get your smile back, to get your life back. You walk in with failing teeth, you walk out with teeth that are smiling and chewing, that are healthy, that are pain-free, that you can go and enjoy the rest of your life with.
Now, I had you on the program, more than I think 3 or 4 years ago.
Yeah.
What's changed since then? How's it different?
In a lot of ways, it's different. I think the thing that changed the most is my appreciation of how much these procedures change the life of the patient. What's changed also is the technology changed a lot about the way we do these procedures. It's done faster, better. There is less downtime. For example, we are one of the very few in whole New York State dentists who have robot-assisted implant surgery. The precision that you get.
Is that right? It's a robot.
Yes, robots are everywhere now, Randy. So robots assist us in surgery, and you can get precision in a way you just simply couldn't before.
You mean the surgical part of it?
The
Like
surgical
it's a robot arm?
It's a robot arm. Looks just like a Schwarzenegger in Terminator.
Okay,
but, it's not, robot is not doing the surgery. I'm doing the surgery.
Okay.
But the robot helps me place those implants with an absolute precision that we just couldn't achieve before. That means I can plan the way teeth gonna look ahead of time much better. I can discuss with patients the way they want those teeth to look beforehand. I can deliver this surgery with less bleeding, less downtime, sometimes no incision, no cutting. So technology changes, and our expectations of what we can deliver to the patient changes for the better as well.
Now, you're one of the busiest guys in New York doing implant dentistry. Is that right?
Well, that's what I like to do, yes. Busy is good.
And you're all over the internet. I mean, people talk about you. And also, I should tell you, look, we've been doing this program for 24 years. You brought in a stack of photos. We can't even use all of these photos. So you have lots of before and after photos. And I told you, going into this, I always think, well, it's just teeth. But some of these photos that I was flipping through, they are, and I'm not trying to side with you, right? But they're pretty dramatic. It is a big thing. So it is life-changing. Because I always say, well, it's just teeth. But you say it's not.
It's not just teeth. Because who misses a back tooth? your average patient may not even notice.
Okay.
Right? But what it does, it changes the way my patients are able to enjoy their life. When you can go out and eat things that you couldn't eat for years, for decades sometimes. When you can smile in a way you couldn't. When you no longer judged just because of the way you look. Because people don't assume things about you, that you're less successful, less intelligent, less healthy, less happy, right? That's what it's all about. It's really not about putting an implant in someone's mouth. It's about changing their life for better and people able to enjoy their life and not think about their teeth.
Are you ever surprised at what an impact this has on people? That means you give them their upper and lower teeth, a new set. Are you ever surprised?
All the time. All the time.
To them, it was like the biggest thing ever.
That's the biggest reward in what we do. When we have patients tear up once we deliver the final, and they go, "Oh my God, I wanted this for I don't even remember how long. I've never liked my teeth. I haven't liked my teeth since I was a teenager."
Really?
Yes.
Now, because you've been on TV for quite some time, you say some people have watched it for 3 years, put it off and put it off and put it off and finally come in.
I'm so proud of those patients.
And they're still
Randy.
skeptical, though, when they get there, right? Is that true?
Of course, because they've been through the ringer, right? They've been through dentist after dentist telling them, they've done what they've been told to do. They've done root canals, they've done gum treatment, they've done veneers, they've done all of this stuff, and they're still not happy with the way they look. They still can't function the way they think they should be functioning. Just because we're getting older doesn't mean we have to feel old, doesn't mean we have to look old. We're still in our minds 20s and 30s, and we want to live our life that way. So
Good. Now you brought a stack of photos. Let's go through some of these
let's get to those. So this is a little bit of a personal story for me. This beautiful lady helped take care of my grandparents when they were older.
Oh, nice.
And what we noticed, she would never sit down for a meal with us. And I asked her, "What's happening? Why not?" She said, "I'm not comfortable. Not comfortable eating. I'm not comfortable seeing other people see me eat." She was a denture wearer, but she was given the dentures that she was never able to wear. So she would go into her little corner and eat by herself. And the change that we were able to give her in her life is just absolutely amazing. So what we did for her, we gave her upper and lower fixed teeth. And look at the transformation.
It looks good.
Would you say she looks younger, Randy?
Actually, much younger.
Yeah. Because it's not just about the smile. Smile, when people think about the smile, they think about the teeth.
Okay.
The way your smile changes the way your whole face looks. Your muscles are more relaxed, your face is more relaxed, your lips look different, your eyes look different. We can see all of that.
You know her, right?
Yes, personally.
What was it like when she saw her face in the mirror for the first time?
She cried. These patients give me the best hugs ever. I learned to be a good hugger, all because of our patients.
Now, you know, when you give somebody a brand new set of teeth, they're happier. Like your wife, she doesn't do the implants within the practice. Is that correct?
I'm glad you brought up my wife, Randy, because that's one of the things that makes us unique in our center. There are practices that only do one thing. You come in, we take all your teeth out, we put implants in.
Okay.
What we do is we give you options. And that's one thing that I don't think in our industry we do enough of. We listen to you. We ask you, what is it that you want to see in the end first? How long do you want this to last? How healthy do you want to be? How preventative do you want to be?
Do you save teeth sometimes? Like people come in, they've seen you on TV and they think all their teeth have to be removed and they don't?
Absolutely.
So that happens.
Of course, it happens all the time. Yes, there are cases when sometimes all the teeth have to go. Or all the teeth have been removed already, so we need to give a replacement. But there are many cases that are combo cases where we can save some teeth, and if those are healthy teeth, we'll do everything we can. We'll pull every tool out of our toolbox and we'll save them.
Nice.
And we'll replace what you've lost. And you'll still get a great result. You'll still be able to smile and chew and do all the things that you want. Back to Eleonora. She's now eating with us, Randy.
Okay.
She's eating with her friends. She can't stop smiling. Her kids are happy for her. She can eat whatever she wants. One of the things we talked about, people who are missing teeth or who've been denture wearers or failing teeth, they can't eat what they want. They can't eat healthy in a lot of ways.
Okay.
They can't eat your salads. Small things are difficult to chew. Cucumber, corn on the cob.
So they can eat whatever they want with their new teeth.
They can eat whatever they want.
What do they like more? What they could eat or how it looks?
Great question, but both.
Okay.
Because we get different kinds of patients, and for some, function is the most important.
The eating part.
The eating part. What can I eat? When can I eat my steak? When can I eat the peanut brittle? When can I eat a cucumber?
Okay.
That is what drives them. Now, we give them the function, but the transformation that they see in their face, in their smile, it's always a welcome benefit. Then you see them taking selfies, then you see them smiling with their families on the photo when they never did before. Some of them, the biggest compliment we get is, you know, my friends, they all say something changed about you. We don't know what it is, but you just look healthier, you just look happier. What did you do? Is it your eyes? Did you do plastic surgery? No, they did their teeth, and now they look happy, they look healthy. Let me share this next patient.
All right.
Novelle, beautiful lady, came in to us for years, for decades she was suffering. She was given a denture. She was never able to wear that denture. It was uncomfortable, it didn't look good, so she went without the denture. Now, people judged her for that. She was not happy with the way she saw herself.
Okay.
She told me, when I look in the mirror, I'm not the person that you see in that mirror. Now, she had a wedding to go to. She took care of this kid, and now this kid is an adult and he's getting married. She said, I want to be proud of standing at his wedding, taking pictures to him. She was the guest of honor of his wedding. And we were able to give her the smile that she could be proud of. And not only she was proud of the smile, she was chewing and eating at that wedding everything that was served at the wedding. Yeah.
It is a dramatic after photo.
Wouldn't you say she looks younger there?
She
Randy?
does look younger. That's almost, it could be the daughter of the before photo.
Exactly. The most important thing is she now, when she looks in the mirror, she says, this is who I am. This is who I've always been. You gave it to me. Now, this next patient, I often get asked, how old is too old? Some people have been told, well, why would you do this? You're older now.
Well, how old can you be? Like, what's your oldest patient ever?
There is no age limit to this, Randy. Okay. I have patients in their 90s. Just because people get older doesn't mean that they have to socialize less.
So the implants will stay in their mouth at 90 years old?
Absolutely.
Really?
There is no age limit to this.
Okay. Anyway, back to this patient, comes in.
Actually, his daughter brought him in. She said, my dad worked his whole life. He's been very successful, but I'm noticing he can't eat what he wants. He doesn't smile as much. He deserves all of that back. Again, the options that were given to him were your conventional dentures, the ones you take out and put in a cup at night. Just because people said, you're older, what do you need something better for? That's absolutely not true. He wants to eat his apples. He loves, one of his passions, he loves to travel. Well, when you love to travel, one of the big things about traveling is tasting local foods. He used to go all over the world. Africa, you want to taste.
That's good.
You want
good
to
point.
get you want to get
they tell
the
you
taste
this?
of the. Yes, I get the life story of the patients. That's the most rewarding part.
Okay.
So take a look at him.
He looks happy, for
he
sure.
looks happy. He's happy. He's able to eat. He's able to smile. He's able to travel and not worry. Am I going to break another tooth now? Am I going to be in pain on my travels?
In your opinion, how long did he have bad teeth? Because you told me, you said people hold on to their bad teeth too long.
Decades, and that's
So
why
he missed out on like 20 years, you think?
He missed out on many years. This process for a lot of these patients is gradual. They lose one tooth at a time. It's painful, it's uncomfortable, people are fearful. People lost trust. We're able to address all of that. Sedation dentistry is big. We sedate them, so there is no fear. They remember very little of the procedure. It's very healthy. It's a much healthier way to practice.
But what if you have bad gums? Can you do it? I mean, if you have gum disease, can you do this?
Yes, and we do it all the time. One of the reasons people end up not doing dentistry sooner is because they've been trying and trying and trying to fix those unhealthy teeth and unhealthy gums.
So you get rid of the infection?
Yes, and that's the big benefit of doing the treatment. That's why the core value is everybody wants to look better. Everybody wants to chew better. One thing that is not talked enough is about how much healthier does this make you? How much more vigorous you are.
Really?
How much more, physically stronger you are. We have an epidemic of this country of heart disease, of diabetes. Well, this is the entry point to your body.
So if you have an infection in your mouth, there's going to be an immune response.
Of course.
Is that right?
There's going to be an immune response. Your diabetes is going to be worse. Your heart disease is going to be worse.
So the infection goes away, and it's just one less thing for the immune system.
That is probably the most important thing that we can give our patients, health.
Okay.
Let's talk about Jamie. Jamie is a musician. Now, what happens to a lot of musicians once they lose their teeth? They're not able to sing, they're not able to perform as well. That's been Jamie's case. Again, the choices that were given to him, he would end up in your dentures, conventional dentures. You can't sing the same way with a piece of plastic in your mouth that covers half of your mouth.
Do they come in requesting this? Like maybe they saw you on TV or something, because you're all over Google. Do they say, I want new teeth that don't come out?
Some
supported
do.
by implants.
Some do. Some patients know exactly what they want.
Is that right? Okay.
And some just come in and say, Doc, I'm just so tired of this. I'm tired of not smiling. I'm tired of not able to talk the way I talk and sounding the way I sound. I'm tired of not being able to chew my food. So
for him, what'd you do?
We gave him a set of upper and lower fixed teeth. He can smile.
When you say fixed, mean teeth that don't come out?
They don't come out.
Okay.
They stay in. He can.
Handsome guy in the after.
Good-looking guy, right?
You say teeth make you look better. I think this is true.
They make you look better because they make you feel better. And when you feel better, it's in your eyes, it's in your smile, it's in your whole body language, it's in your confidence. That is something that you cannot put a price on. Let me show you this patient.
All right.
Take a look at the before, Randy. She came in, she was told she has no options. She was given dentures. She was told she has so much bone loss that nothing can be done.
But it is true, if you've been wearing a denture, right, for 20 years, you can't do this. You don't have enough bone.
Not true.
Okay.
There are techniques, there is technology, and there is experience now where we're able to give patients the treatment that they desire that we probably could not do 10, 15, 20 years ago.
So she comes in very skeptical.
She comes in not believing because she's been told over and over again, sorry, there is nothing we can do. You lost too much bone.
Okay.
Well, take a look at her after.
Wow.
So what we did for her, we gave her upper and lower teeth locked in into implants. So take a look at her after.
Looks good.
Doesn't she look younger?
She does look younger.
And she can chew better. And she doesn't have to take those teeth out anymore.
She actually looks like she could be the younger sister or daughter of the before photo. And I said this on an earlier one, but this is, I think, pretty accurate.
That's a common story, Randy. It changes the way you look. You look younger. You look younger, you look healthier. And you feel younger and healthier. Look, I don't know what she's eating, but she's able to eat everything.
Okay.
And that's another part. Not only they are able to eat, they are able to eat healthy foods. And they are able to chomp on those foods better.
Okay.
They're able to digest them better. Makes them healthier and makes them look better. Take a look at this patient. One of my absolute favorite patients. Always so happy. Now, if you look, she always cared about the way she looked. Her hair is done, her nails are always done. But the way her teeth looked didn't match her personality.
Okay.
And she couldn't eat well with them. Now take a look at the after.
Looks good.
That is the lady, her smile now matches her face. It looks age appropriate, it looks face appropriate, and her smile looks absolutely beautiful, and she feels beautiful.
It's very nice. Now, you were saying, because I was telling you in the green room that these teeth look really good. So you have like an in-house lab. You have a lab, like a smile designer that meets some of these patients.
Yes.
That helps design the teeth. Is that right?
We design their teeth before we actually do the surgery. There is a process. There are a number of people involved. We always sit down with the patient and we ask them, what do you want to see? We pick the size, we pick the color. Now with the advance of digital technology, we can play around. We can envision what it's going to look like beforehand. And yes, we have a dental technician who is there during the surgery. And we're 90-something% of cases able to give them fixed teeth on the day of the surgery.
That's nice. That's teeth that don't come in and out.
That's teeth that don't come in and out.
Okay. Now we're short on time, probably 5 minutes left. And I know you have a stack of photos still.
All right,
so I'm going to rush you a little bit.
That's fine. Let's go through them. It almost sounds too good to be true, but these are the patients that come in.
Wow.
They've been losing teeth one after another. They've been doing patch-up work here and there. Well, when you do patch-up, it looks and feels like a patch-up. Veteran. Served the country. Very funny guy, very healthy guy, likes to bike. Now his smile matches his personality. Now he's able to eat whatever he wants and he's able to smile.
You say a lot of these people go years without smiling.
They go years without smiling. This is the hardest step to do. That first phone call to Dr. George is for a lot of these patients, it's the hardest step to make because they've been suffering for years, sometimes decades. Sometimes they've been told that there is nothing can be done. So they're fearful, they're apprehensive, sometimes they've lost trust. Well, once they come in and they have the options given to them, so they are in control. They are the ones that are telling us, I want this. They have all pros and cons laid out to them. They are making informed decision. They know what to expect. They know how long it's going to take. They know how much it's going to cost. A lot of the fear and a lot of apprehension is removed that way. So they're able to make the decision and make that step that they've been waiting for years, decades to make. Some patients tell me that they've been watching the show. They saw the show 3, 4, 5 years ago. They just couldn't get themselves to make that phone call. Well,
that's the hardest part.
It is the hardest part.
Nobody likes going to the dentist, right?
Well, it's complete opposite of going to the dentist. You go to a regular dentist, you have a lady or a guy in a white coat standing over you and telling you, bad boy, bad girl, you've not been taking care of your teeth. Now you need this, you need that, you need that. No, that's it's different in our office. We ask you, what do you want? There is no judgment.
Good.
What do you want to see? What results do you expect? How long do you want this to last? Let's sit down, let's design it together. Let's walk through the process. And then the reward in the end is you look better, you feel better, you're healthier, you're smiling, and we are happy that we're able to make this difference in your life. So another patient whose option would have been irregular dentures that they probably can't wear or don't want to wear, and now she has teeth supported by implants that don't come out, that she's able to eat and chew and looks
very nice.
Younger.
Very nice.
And this story repeats itself over and over and over again, Randy.
Wow.
These are patients that have been suffering, that have not been able to smile, that have been staying away from family functions.
They tell you this?
Yes, they tell me all the time.
They're just ashamed or embarrassed or what? Or they can't eat in front of people?
Well, if you have teeth that are about to fall out every time you try to bite into a hard crust bread or a sandwich, you're probably not going to want to do it in front of people.
Okay.
So that's what they've been going through for many years, oftentimes. And that makes them not want to go out. That makes them not want to smile. That makes them skip family occasions, birthday parties, Thanksgiving dinners. When you go to a Thanksgiving dinner, you want to bite into a turkey. You want to bite into corn, right? And I'm just so happy that we're able to give it to them.
Now we have to mention, and we're very short on time, but dental insurance really doesn't cover this. Medicaid, Medicare doesn't cover this?
Yes, but people are financing this, Randy. We're able to spread out their payments over 5, 6, sometimes 10 years.
Okay.
So they're able to fit it within their monthly budget.
So they have to have some credit. Is that correct?
Yeah, as long as you have decent credit, you're able to finance it.
Would you say more than half of the people are financing this?
I would say so, yes.
Okay, good, good. Time for 2 more.
All right, let's
Quick,
go.
we're going to rush you.
We have a foodie here. Likes to eat. Really likes to eat. Likes to eat his steak. Likes to eat his pasta al dente. Doesn't want to eat mushy risotto. He couldn't do any of that stuff. Now, look, he's not only looking younger and looking better, but big, important part of his life is enjoying food, and he's able to do that now.
Nice, very nice.
One more, Andy. Now, what I wanted to mention, these are teeth that are custom made for you.
Okay.
This is not off the shelf. We have to sit down, we have to talk about your face structure, about the color of your eyes, about how the teeth will look in your mouth, and that's when we're able to do our best
So
work.
what was going on in that before photo? Because the teeth looked okay.
Failing teeth.
Okay.
Failing teeth, pain, discomfort, those one of the patients that we talked about. Gum disease, a lot of dental work done.
She's very young.
Oh, that's not our typical patient, yes, but we have young patients as well because they've been through the ringer. They've seen many dentists. Many dentists did many procedures on them. They're tired. They just want to have their nice, healthy-looking smile.
So she would have been in a denture.
She would have been
So
in
now
a
she
denture.
has new teeth supported by dental implants.
Exactly.
Those
Teeth
look
that do
like
not
porcelain
come
veneers.
out. Yes,
These
you
look
cannot
pretty
tell.
good.
They look. She's happy. So as long as she's happy, I'm happy.
Now we're out of time. Final message, somebody watching this, they're the 2 groups. They either are wearing a denture, they're skeptical, or they have really bad teeth and gums. Maybe they've heard what you have to say today, but for whatever reason, they're still skeptical or afraid. What do you say to them?
We know what you're going through. This is what we do every day.
Okay.
We want to change your life. We want to give you smile. We want to give you ability to eat. We want to give you your health back, your vigor back. The most important thing is picking up that phone call and giving us a call.
So just come in and at least know your options.
Yeah, no pressure.
Do they meet you on most of these consults?
Yes, they do. Most of the consults, all of the consults, they either meet me or my wife. We talk about what we can do for them. We give them a lot of education, so that way they can make an informed decision.
All right. Dr. George, thank you for coming on the show. Always a pleasure.
Thank you very much, Ren.
If they want to make an appointment, do they go to the website or just call your practice?
Either or.
Either one.
They can go to the website, they can pick up the phone and call and ask for a consultation with me.
Are all these photos on your website they can look at?
Most of them are. You know, we do so many of this that we don't get to update them every day. But yes, they can scroll through the gallery and see who looks most like them.
Dr. George, thank you again for coming on the show.
Thank you very much, Ren.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.